gone to doctors and seen how they work. They follow a very regimented workflow. They will have you go through a PCP, and then they will refer it to someone. And I've gone through multiple ways to tackle, say, one or the other problem, but I always feel nobody is dialing down to figure out a root cause of the challenge, whether it's the way I'm eating, whether the way maybe my sleeping habits or my stress level. They are just very regimented. Okay, do A, B, C, D, otherwise go do this test and do that test. Uh, so how will you, so that I always feel that holistic aspect is always missing, either because of the way pair provider relationships are structured or just the way they have been told, either because of liability or something along those lines. So how will you bring in this holistic aspect back into healthcare, not just management of your symptom?
I mean, I believe that that's the hope. CMS pushing value-based care probably a little sooner than we were actually ready for it is the hope that the 5% of healthcare expenditures, 3 to 5% that go to primary care, preventive care, is misaligned. We shouldn't be spending 95% once people are actually, living with chronic illness or have some sort of catastrophic event. So I think we all know that it needs to happen. But foundationally, what needs to change is we have to stop believing in the health belief model when it's been widely discredited for decades. The health belief model is if people know better, they do better. And that's just not true. I have habits right now I could tell you about that I know absolutely are not good for me, but I'm still doing them because they're kind of harm mitigating, right? I'm like, well, it's better than this. You can't just assume that educating people or giving them access to things is what changes their behavior. That there are just too many other, again, contexts. And the context is situational, it's it's moral, it is deeply about where they are in their life course, it's geographic. I mean, yeah. So I think the holistic perspective is what you get when you include nurses in the conversation, because we are not Western biomedical model focused. I don't know if you know this, but we're a completely different scientific tradition that believes in holism. So we actually believe in removing the body's barriers to healing itself. That's one of the things. And the other thing that we believe is that we are here to help patients live the best version of their lives, their version, right? Not my version. And so if your version includes fast food and cigarettes, I'm not telling you that you're an abject failure if you're doing that. I'm trying to work with you to make it, less dangerous, less risky, augment other parts of your life. Our systems right now are built on the Western biomedical model. If we give you the right knowledge and access, we assume you're going to do better. I don't know why the system would be any less flawed if we just, involve data.